Okay. Now what we're going to do is that we're going to go through generally about what is hair transplant all about, right? The hair transplant basically, from my perspective, is not to give you hair, right? I'm not interested in giving you hair. I'm interested in giving you the hair which cannot be recognized by other people as if something has been done. I'm sure, so many people, there are about, thousands of surgeons around the world doing on an average of 1 to 2 surgeries per day. So we are talking about hundreds of thousands of surgeries per day, right? You might have come across 1 or 2 people who are having a single line. I was watching this movie the other day. It was Get Smart, right? So in Get Smart, the second in command with the baddie one, the short guy, he had a hair transplant done. You could actually see a straight line over there, right? So he had a hair transplant, and that could be very obvious from a distance, right? A distance means even at this distance, sitting from that corner, you can tell, your eyes can tell that something is unnatural about this thing. It is that stare I don't want anybody to have. They can say that, oh, his hair is thin out, his hair is thin out, his hair is thin out, but at least they should not say that, oh, have you got something done? I don't want that thing. So that is what I call as natural looking hair transplant, right? I go around the world giving lectures on naturalness, and one of the things which happened to me is that I'll show you later on in the picture, I was doing, at least if you're coming to a person, you are doing a cosmetic surgery, you are paying them well, you are, everything, you need to have at least a nice clean place. It should be according to the international standards. We have got the pulse oximeters. While you are being operated, there's a television, there is a DVDs and all those things, so you can watch whatever you want while we are doing it. This is my clinic in Islamabad. Now, patient selection. This person is not a good candidate. You can see his hair is very, very thin. And number 2, somebody has still done so many surgeries. 1 cut, 2 cut, 3, 4, 5. So, this is not, if you do not have a good candidate, which is type A and type B, which has got 200 hairs per square centimeters to 150, they are the best ones. This is, where you would still see the base over here. If you can see the base over here, you will see the base definitely over there. So they can still get something done, but type B, they are not good candidates. We all learn the hard way as well. Now, the first, patient concern and expectations. All of you have got different expectations, different concerns. As a doctor, I will listen to each one of you individually. Try to grasp what is your main concerns. Now, my problem is donor area. As I said, my limitation is your donor area. You have got a wonderful donor area. I've got no limitations. Then how your hair loss pattern is, which determines if I see where is thinning happening, how young are you, that will determine me what can be done. And then if you are young, in 20s or early 30s, I have to anticipate the future hair loss, right? If I don't do anything, leave anything for the future, right? Anticipated future hair loss, very important. A patient who is 25 and has class 2 or class 3, he can go to class 7 in 10 years time. So if I am not careful and I try to take a donor area which would fall off, all those hair which I've taken from there will fall off, right? You will see that scar will become visible. So your donor area, a doctor, this is the work of a doctor. He must understand the area I'm taking it from would be the last one to fall. So that is why it is important. And if you are doing it in a much younger, sometimes you can go a wrong area, right? An art is subjective, which means that something which I'm inspired by, maybe another person might not get inspired. some of the people will go to Sistine Chapel and see the work of Michelangelo and would not even appreciate, yeah, it's fine, but some of the artists would really realize how difficult and only they can. So it's an opinion. But the important thing is that in the hairline, where should it be? Should it be this, or that? There are difference of opinion. I try to do it. I basically see and measure different things. In an attractive face, you have to see all these 7 points. For example, a person who has got a longer face, you have to measure different areas, where is near, all these areas, and see the difference. And then you calculate and look at him, he is type 7. I'm trying to bring it over here and see, and all these markings tells me where to do. And then the determining factor for the general appearance of the face is that the height of the calvarium. This is that you want to see the forehead, you want to do the width like that. I mean, you should not have things like that. They should fall on your forehead. They should fall on the forehead. This gives softening appearance. So very important, your hair should be falling onto your forehead. Now this is where it is. Can you see these hair going straight up? And can you see these hair all curling down? It was this patient who prompted me in the first place that, wow, we must look, where are these grafts? Are they present over there? Yes. So I bring them over in this transition zone. The naturalness is all over here. This is density. So I do not worry about this place. I worry about the naturalness. And then you can see all these here in the front ones are curling down. The fronts were curling down. This is hair transplant. This is what I do initially. And teamwork, I mainly used till about few months back, I was only doing loop magnifications, and those pictures which you saw with one single hairs, very fine ones, they were done with loops. In Asians, our hairs are very thick, right? In Caucasians, they've got very thin hair. So for them, you need a little bit more magnification. For us, we don't need magnification that much. So most of that, but now I have shifted over to microscope dissection as well. But these are all these pictures are the patients who had no microscope used. Right. This is again, you can see, now this is where I would do a follicular unit extraction. I only need this small little area, about 50-60 grafts, right? But then you can have it done in the beard. Now see, I have taken the donor area so that I can put some of the